Today we've got Dr. Harbinder Sandhu, an associate professor at Warwick, who's here to talk to us about mental health and the impact of the coronavirus on the South Asian community. So nice to have you on the show today, Dr. Sandhu.
Thank you for inviting me.
Yeah. So just tell me a little bit about yourself.
So I work at the University of Warwick, Warwick Clinical Trials Unit as an associate professor, and I'm a psychologist. So I see patients that have long-term conditions, mainly chronic pain, and we talk about self-management and improving quality of life.
Okay, wonderful. So just tell me about your experience with mental health in Asians, just from your psychology perspective.
From my perspective, I think there's still a lot of stigma related to mental health within the South Asian community. It's still not spoken about openly. There's still a lot of stigma attached to feelings of depression or anxiety, low mood. And there's often, it's seen as a sign of weakness. And sometimes people can be afraid to actually come out and seek help because of that.
Yeah, no, I see that as well. I mean, I'm working as a GP in Birmingham, and we're seeing that with our patients more so. There's a huge amount of fear in the society at the moment, especially over the last few months with coronavirus. How do you think coronavirus has changed things, and what are the challenges with the society becoming more isolated?
Yeah, so I think the coronavirus has definitely brought to the forefront the importance of mental health and well-being. And I think the positive aspects of that has been the sort of campaigning about it, being able to access resources and speaking out if you are not feeling particularly well in terms of your mood. But also I think a lot of people may be struggling because of the stigma attached to the, seeking help in the first place. And quite often they may then be struggling alone and become more isolated because of that. So I think the challenge is really now within the South Asian community is how do we really support people in terms of their mental health, and how do we make services accessible to them and really encourage them to reach out.
So do you have any coping strategies? So if you could just say 5 points for our listeners and viewers to keep their mental health stable and stay as healthy as possible.
Absolutely. So I would say 5 things that you can do. First of all, establish a routine. So although you're at home and you may not be able to go to work and your normal day-to-day things have changed, it's important to still think about your wake up time, you're going to bed time, having your sort of set meals, your breakfast, lunch and your dinner. So still having some sort of routine and structure to your day. And not being so hard on yourself on the days where you have no routine. It's not like you have to be so strict for 7 days a week. Yeah. Some days you just need a day where, you just want to sort of sit on the sofa and relax, but that's okay as well.
Yeah.
And the second tip is to remember that when we say physical isolation, it doesn't mean social isolation. And within the South Asian community, family and connection with our loved ones is important. So reach out, connect via the telephone, internet, or and as the forever changing rules are coming out from the government in terms of easing lockdown, it's seeing what you can do. So if you can now go and see one family member, but keeping that distance, still following the guidelines from Public Health England, but just remembering that things are changing, we will get through this, and keep connected as much as you can.
Yeah. Okay. So any techniques like mindfulness or any kind of practical techniques we can use to improve our mental health?
Yeah, so the third tip I would say would be definitely about yourself. So thinking about how you can use strategies to help perhaps calm your mind a little bit. Just take a few moments out in the day, and perhaps by looking at putting in some form of meditation or relaxation or mindfulness. So there are some apps which are available that are, such as Headspace, but there are lots of other online resources as well. And it's just taking that time out to breathe, and really just to calm your mind if you are feeling a bit overwhelmed.
Yeah, so I mean, I struggle to get quiet sometimes, so I like to listen to music, and that's kind of a mindfulness process for me to relax. And some people like
Absolutely.
to go for walks. I can see that you're sat in a nice forest. Um, so what about
Yeah.
getting out for walks? How does that affect
Yeah.
people's health?
Yep. So that would probably be my fourth tip, would be to remember about keeping mobile and getting fresh air if you can. So even if that's, sort of walking into your garden, or if you haven't got a garden, it's, going perhaps just outside, and just making sure that you are keeping mobile, getting fresh air. And I do like this picture because it often reminds me of connecting with nature and getting out
Yeah.
there.
Oh, yeah, that's wonderful, because I like to go out and go for walks as well, and I think this is a good opportunity to create a habit of regular walks, because I think that in terms of the physical health, so I'm just looking at things like diabetes, blood pressure, obesity. These are all problems that might emerge from being too, physically inactive as a result of coronavirus. And to make this routine happen during this period of time might be a really good opportunity for us.
Absolutely.
Right?
Yeah, and then my fifth tip would be to remember that it's okay not to be okay. So take some, similar to the meditation, have some quality time with people, whether, like I said, it's connected through the internet, but also taking time out for yourself.
Yeah.
Focus on, what goals you've set yourself, adding value to your day. So really think about yourself, being kind to yourself, and being kind to others.
Yeah, I think that's very important. It's often a point that we miss as well. When you're fully into something, you very rarely take time for yourself
Yeah,
consciously. So I think it's important to build it into an everyday routine.
yeah.
Is there anything else that you'd like to talk to us about today, Dr. Sandhu?
I think just to say that, I think remembering that culturally and as a society, that there are lots of positive things that have happened during this time, and quite often, it's very easy to focus on the sort of the fear or the things that are challenging and worrying to us, and forget about actually how communities have come together and supported each other, and how many acts of kindness there has been. And I think just to remember that if you are accessing social media for keeping up to date with news and so on, and you are feeling overwhelmed, it's to perhaps limit the amount of time or what you're actually sort of looking at, and focusing perhaps on more of the using the social media as a positive tool, rather than always sort of taking on all the fear.
Yeah, it can paint quite a scary picture of the world sometimes,
Yes.
social media, so it's good to limit the exposure if possible. Thanks for speaking to us today, Dr. Sandhu,
No problem.
and we hope to speak to you again shortly to
Yes.
share more wisdom. And if anybody's got any comments or any feedback of what they'd like to hear, or any kind of tips they'd like to have, then please do get in touch with us. I'll give you a link for the website for the South Asian Health Foundation at the end of the video, and we'll see you next time.